Good evening, everyone. I once again welcome you all in our podcast series of Sunday Start with Real Stars. Today we have one more eminent speaker, Dr. Divya Madam. Before I welcome Dr. Divya Madam, I want to highlight her background, her achievements. Dr. Divya Madam completed his UG from Karnataka and completed his PG from Alvaz Ayurveda Medical College itself from Karnataka. Ma'am did his PhD from Parul Institute of Ayurveda, and also ma'am has a extraordinary knowledge in Jyotish Shastra from Somnath University. Ma'am conducted various seminars in the Khemdas Ayurveda Hospital. Ma'am is an in-charge active member of various committees and holding a good clinical skill in neurological disorders. Till now, ma'am treated more than 1,000 patients of neurological conditions and musculoskeletal disorders. So today, I welcome you, ma'am, on our platform.
Namaste to all. Om Shri Dhanavantharaya Namaha. Thank you so much, Dr. Vikas, for inviting me to share my thoughts with your listeners. Okay, we will start with the session.
Yes, madam. So, ma'am, today we will talk about geriatric area, okay? Because you have a long experience in the neurological disorders and musculoskeletal disorders, and generally these problems are faced in the geriatric phase. And whenever we talk about geriatrics or aging, so a question arises that can we retard the rate of aging, and what is actually aging?
Okay. Yes, Doctor. See, in the present scenario, what happens? There is a lot of change in the lifestyle and the dietary habits, and the main is a stress has become the positive factor for the early aging. Nowadays, we are seeing the children with a early graying of hair, and in the adulthood only, the people used to get the wrinkles. What happens is the every man desires to live long and healthy, but no man wishes to be old, and it is applicable in the present era also. But uh, getting old is a quite natural process that one need to understand. And one more thing is it is not a disease and it is a inevitable phenomenon. A recent survey study in India, what it has shown that by 2030, 20% of the whole population of the India comes under the elderly population. Elderly population is the people what we categorize about the age group of 60. 60 years above comes under the elderly population. Or the we can say that person has reached to old age. Okay, we classify the age, we can classify it into three broad categories. That is the biological age, how we can appear, depends upon the biological age. Chronological age is the birth date, means the birth year and the birth date will be
Yes.
your chronological age. And the psychological age is how we feel ourselves. You might be seeing some people, though they have reached the old age or the fifth or sixth decade of the her or his life, but they will be doing the work or their mindset will be they are in the third decade or 30, 35. But this sort of people or this percentage of the people are very less. Being the Ayurvedic physician, especially in the Panchakarma physician, we can help the patients to or the person delay the aging by following the Ayurvedic principles in their day-to-day life. So we can, of course, retard our the old age.
So we can definitely promote healthy aging with the help of Ayurveda. So,
Yeah.
ma'am, tell me some more about that. People first of all used to hesitate come to the Ayurveda field, and they think that it will take a lot many days to take the treatment of Panchkarma or Ayurveda, and there is always a confusion that we will get results or not. So kindly tell, can we promote, how can we promote healthy aging with Ayurveda?
Yes, yes. See, first of all, you say if we see, this you told the we will not get early result with Ayurveda. Yes. Why? Because the people comes to us in a very late stage, very late. When the disease becomes chronic, they will visit us. That may be a one main reason. And if we see about the motto of the Ayurveda, what it is, Swastasya Swastharakshana and the Aturasya Vikaraprashamana is the main motto. In that, primary motto is the Swastasya Swastharakshana. Is the we are going to prevent the disease. There is a famous saying in English, prevention is the better than cure. That we are going
Yes,
to follow by the following the dinacharya and the rutucharya. That is the do's and don'ts a person need to be followed during a daytime and during the specific season. It has been explained in the Ayurveda. If a person comes to you, you are going to make them understand dinacharya and the rutucharya. So by following when the dinacharya and the rutucharya, following the dinacharya and the rutucharya becomes one's routine, we can maintain our health. So we will not become sick, and of course, obviously, we are going to uh, delay the aging also. And about that, if at all a person becomes ill, the next mode of the Ayurveda is the Aturasya Vikara Prashamana. Hence, if at all person falls ill, then we are going to treat the disease accordingly. So, to delay the age, Acharyas have the ancient Ayurvedic scholars have explained about the Rasayana and the Vachikarana therapies, and the yoga and the pranayams are better explained in the Ayurveda. And the one more thing is the Panchakarma. Of course,
yes,
see, if at all Panchakarma's names come to anyone's mind, they think only about the massage therapy. It is
yes.
not like that. It is, no, we are having the sets of the treatment. Panchakarmas is the five basic biopurification therapy, but before that and after that, we are to do as per the patient's age and strength. We can adopt or we can prescribe many more therapies to the patient. And with that, we are going to prevent the aging or we can delay the, of course we cannot prevent, we can delay the aging. And some people see they quite in old age what happens is it is quite natural. People may have suffer with there will be psychological changes and a person become a retirement with, from his work, and due to that he may undergo with the depression. There may be a lack of enthusiasm, lack of concentration, loss of memory, and they may feel loneliness in the old age, and there will be physical changes that one need to accept. Changes in the skin, they are going to get wrinkles, constipation, dyspepsia, and there will be vision problems. And if we go through the prevalence rate of the diabetes and hypertension, it's more in the fifth and the sixth decade of the life. So, and heart disease, according to the disease or according to the condition of the patient, if at all a person or the patient consults a Ayurvedic physician, he or she may can help that patient in treating such problems accordingly.
So, like any instrument or machine, we timely service it. We can
Yes, yes,
uh,
yeah, yes,
we can we can extend the lifespan of that instrument. So likewise for our human body, there is a panchkarma therapy. With biocleansing we can promote longevity, and even we can reverse aging at certain extent, because it's not about the cosmetic thing, it's about the healthy organ and healthy organ
yes,
system. And
obviously.
adding on, when we see the celebrities, especially the old age celebrities, they also go through the panchkarma therapies in the health resorts in southern India. So it's a very beneficial therapy. One term you told, ma'am, that rasayana therapy. So kindly tell about more Rasayana therapy, what it is and how it helps in the geriatric patients.
Mm, yes. See, the Rasayana, if we split that to that particular word, it consists of two words, Rasa and the Ayana. Rasa is the vital fluid or the nutrient fluid, and the Ayana is the way. So, the way through which one can get the best nutrient fluid or vital fluid to each and every cell of the body, by which a person can become strong or free from the disease, is called as the Rasayana therapy. So, uh, the Ayurvedic classics, they have mentioned the three major classification rasayanas. That is the Kamya Rasayana, Naimitika Rasayana, and the Ajasrika Rasayana. Kamya Rasayana means with some desire we are going to take that particular medicine. That is, for example, Prana Kamya Rasayana, Medha Kamya Rasayana, and the Shri Kamya Rasayana. Prana Kamya Rasayana is to increase to enhance the longevity of the person. And there we can Brihati and such type of Meda, Mahameda, that most of the drugs are not available. And Ashwagandha, it all comes under Prana Kamya Rasayana. And in the Medha Kamya Rasayana is to enhance the mental ability. The drugs like Shankapushpi and Brahmi comes under Medha Kamya Rasayana. And the Shri Kamya Rasayana is the to enhance the luster and the beauty. The like drugs like Jyotishmati and the Tifla comes under Sri Kamya Rasayana. Naimitika Rasayana is a type of Rasayana which we are going to prescribe as per the disease of the person, is called as Naimitika Rasayana. And the Ajastika Rasayana is nothing but it is very easy to take. What we take today in a systematic consumption of the Grita and the Kshira, that is the cow's ghee and the is called as this Ajastika Rasayana. So if we go through the benefits of the Rasayana, what ancient literature has mentioned is the it is going to increase the longevity of the person. It is going to increase the this memory power of the person, and it is going to increase the power of the sense organ. That's rasayana, is consumption of the rasayana under the prescribed dose. I just repeat that the particular prescribed dose means they need to consult the doctor, and they need to take that particular medicine. It is going to enhance the longevity, and it is going to make a person enhance the mental ability, memory power, and its stamina, overall stamina. Uh, so it is going to increase the immune system of the body. So in total, what we can say is enhance the overall health and the vitality of the person.
Person. And as the Ayurvedic principle says that treat the complete body, not a single part. So
Yes.
very well elaboration by Dr. Divya madam. Ma'am, these days we see that these rasayanas like ashwagandha, amlaki, guduchi, these are very famous names in the TV advertisements, and normal person take them very frequently. Okay, they even don't know the dosage, and whenever they get complications, they blame Ayurveda. So, what's your opinion regarding this?
Yes, yes, of course. I also come across such situation. People themselves, after searching through the Google or going through the TV ads or the going meeting with talking chit chatting with the friends. If he is taking ashwagandha, I also consult ashwagandha. If he is taking amalaki means gooseberry. If uh, blindly the another person is also following the same, it happens. And people visit us, such people visit us, and they will be saying that I regularly take ashwagandha and I regularly take triphala without any prescription. It's see, you also know this self medication is always quite dangerous. Maybe with the ashwagandha or the first of all, if at all the adverse drug reaction may occur. due to the incorrect dosage. Because we, being the Ayurvedic doctors, as in the contemporary science, they follow the drug indication and the dosage. It is quite good with the Ayurvedic medicine also. It is applicable, I mean to say, it is applicable for the Ayurvedic medicines also, whatever it may be.
Yes.
So it may be Ashwagandha or the Triphala. So without my suggestion to the listeners is without consulting a doctor, self-medication can be harmful to one's body. And see, if you go through the properties of the ashwagandha, it is having the pitta and the katurasa and the even madhura rasa also, and ushna virya. If this ushna virya, it causes heat effect to the body. At all, it is consumed by a pregnant lady, she may end up with the abortion. And if we see the Amalaki's properties, it is having the Pancharasa, Amla Rasa, Pancharasa, Amla, in that Amla Rasa Pradana. It is
Yes.
Pitavirya drugs and which produces coolness to the body, and it is Tridosha Stramaka. Okay, to some extent, taking Amalaki on daily basis, it is good because in the Ayurveda also it has been mentioned, Nitya Sevani Ahara Dravya, the food which can be taken daily. So in that, we have the rice, Shashtikashali, Yava, that is the barley, Mudka is a green gram, and the Saindavalavana, that is a rock salt, and the water, Amalaki gooseberry, Gogrita cow's ghee, and the milk, Madhu, that is the honey, and the Jangala Mamsarasa, that is the meat soup. A separate chapter has been contributed by the acharyas to say or to speak about the properties of this food. Anna Prapana Vidi Visheshayatna. So, in that, acharyas have explained which food can be taken continuously, which food should not be taken. So, that I mean to say, what why I have explained these things means without consulting the doctor, don't take any medicine. And their
Yes.
TV ads and the local vendors, unqualified people practice in the name of Ayurveda. Whatever
Yes.
drugs or the items available in the market under the heading of Ayurveda cannot be a it cannot be taken by the people. And
Yes.
every,
And
as you told, the blame comes from under the Ayurvedic physician.
yes. And there is always a confusion between herbal products and Ayurvedic products because
Yes, yes,
this is a separate branch coming with the herbal products. So, what we can consider them? So very well said, ma'am, that every drug has their rasa, virya, vipak properties, and people generally have a myth that Ayurvedic medicines don't have any harmful effects. If you take in the undesired dose, so it can harm you because there is a physics formula that every action has an equal and opposite reaction. So it may fail. Kindly take the Ayurvedic aushadhis and medicines only by the guidance of Ayurvedic practitioner. And in our India, there is a saying that one nation, one health. And Ayurveda and yoga is propagating worldwide, and people are
yes,
accepting that Ayurveda for all. So,
yes,
taking this statement, madam, of Ayurveda for all, we see while studying Ayurveda that there is every option available for every class of the society. Like for poor people, also we have some solutions from Ayurveda, and for rich people, also we have solutions for Ayurveda. So, there is a very famous word, Achar Rasayana. Okay, it is a kind of drugless therapy. So, please give light on this topic. What is Achar Rasayana?
yes, yes. Yes, Acharya Rasayana has explained, it is Acharya Rasayana, that Acharya is the code of conduct or the ethics to be followed by a person when he or she is living in the society or in the family. There are set of the code of conduct explained in the Ayurveda. See, like one should speak always truth and he should give respect to the elders, and he should be away from the madhya. Madhya is the alcohol, and he should not lie, and he should not get angry, and he should do dana, to the charity, and he should do the pilgrimage, and he should be orthodox. So such things are explained in a very systematic manner in the ancient Ayurvedic classical text. So, what this is called as the Achar Rasana, means nothing but it is how a person should be behave in the society. Because we humans human beings cannot live like a animal. Yes. So, if we see what and all points I told, if you go through that, you are not at all quarreling with the, if you are quarreling with the one person on that day, you will be disturbed totally. Okay. So, and if you are doing on that on particular day, if you do that charity, or on the way to your workplace, you have helped some um, kid, or or the needy people. Uh, at that time, on throughout that day, you feel good. So at that time, what happens in your body? The dopamine and the serotonin and oxytocins are released.
Yes.
These are pleasure from the affection and the connection. You are helping to someone. By that, the oxytocin is going to get released and helps to maintain the emotion. Is the serotonin hormone, and the dopamine, which is the hormone which supports the feelings of the reward and the motivation. So these hormones in total, it can be called as a happy hormones. If
Yes.
you're doing good to yourself, if you're feeling good yourself, if you're thinking good and you're doing good to others, at that time happy hormones are released in the body. So see, acharyas have told the rasayana, that is the rasa is the nutrients fluid. So the by following this achara, the good nutrient fluids are going to get secret within your body. You need not to take any medicine from the outside. And in the contrary to this, if at all you feel or a person gets angry, or he is going to he is in depression, or he is in a dull mood at that time, or he is shouting to other or elders. At that time, what happens? The adrenaline and noradrenaline is going to get secreted. What this hormone does to the body? Of course, it is going to increase the heart rate, blood pressure, and and the respiratory rate in the body. By constant, if at all the same nature he follows, or a person follows, the angriness and shouting to the others, saying a lie. So, if at all this is being regular, it is in the regular practice, there will be constant raise in the heart rate, blood pressure. Of course, it is going to cause the adverse reaction to the body. Yes. Then the patient, the first thing what we call is the stress. If at all the person is going to be in a stress continuously, it is going to cause a hypertension or heart disease. Of course, it is following the Achara Rasayana, it's a drugless therapy. It can be a drugless therapy.
So it can give magical results by silently following it.
Yes, yes, exactly.
Very scientifically explained by Dr. Divya madam. And to my young listeners, I want to say that these are not old-fashioned things, that being honest to your works and helping people, and especially if you talk about geriatrics and old age people, you sit with them, take some positive thoughts from them, and help them, care them. You will definitely get positive hormones in your body, and that positivity will heal you and promote a healthy life. Ultimately, you will get benefit from achar rasayana. So very well explained, ma'am. So it's about stress. You talked about stress, ma'am. So, whenever patient take a long stay in the hospitals, or whenever after long stay takes discharge, he or she gets lots of medicines with them. Okay, and those medicines, whenever they see these medicines, they get very stressful. That my life is only about medicines. And when we talk about especially Ayurvedic medicines, we have certain protocols like taking medicines before food, after food, and thrice a day, like that. So, how to reduce that stress regarding medicines? Because ultimately, it's a kind of discipline to be followed, and if will they will follow sincerely, they will get very early results.
Yes, this problem I too come across usually with my patients also. First of all, to be frank, people come to us at the when the disease become uh, the chronic attains the chronic stage. Is immediately they roam to modern hospital. They consult the doctors and they take painkillers. Of course, I don't blame any science over here. Each and every science has its merits and the merits. We need to understand. And at if at all the patient comes at the end, and of course considering the chronicity of the disease and chronicity in the sense the strength of the disease, if and patient's age and strength, we prescribe them chronicity in the sense the stage of the disease, what we can say. So we give the prescribe them medicine. And in Ayurveda, we, as you told, the quite importance has been given to the anupana. Anupana means the things or the liquid which we or
Boost
the
the
substance
medicine
which
action.
which increases enhance the medicine's action. Uh, we give some medicines with ghee, we give some medicines with honey, we prescribe some medicines with milk or hot water. So, that if at all that particular medicine to be taken with that particular drug or the anupana, it is going to enhance the action in the body. So we need to make them, it is our responsibility being a physician to convince the doctor to take the that sort of the medicine in that way. And one more thing is the if at all the patient is not feasible to take the kashaya, especially there will be there will, it is not easy to take. If at all patient feels hesitation to take, at that time you can change the form dosage drug form like nowadays we are going to get the especially the kashaya and the kwatas are will be in the bitter in nature, bitter to in taste. So at that time we can change that to the kashaya and the arista tablets are also available in the market. We can change the different in different dosage form we can prescribe. And one more thing is the see, if we are, if a person is visiting, if a patient is visiting a Ayurvedic doctor, he examines him thoroughly, and it is the duty of the doctor to prescribe the. He is not going to count the medicine as per the disease strength and the patient's strength and his comorbidities. He is going to prescribe the medicine that the person need to understand, and physicians should convince the patient to take. And it is not that the long term or the throughout the life we are going to continue the same medicine. Depending upon the cure, how he is going to get cure, we can reduce the treatment or the medicine number also. If at all he will be free from the disease, of course we can stop the medicines also, but after the consulting the doctor only.
So there are two scenarios in this problem, that one patient centric, that patient should be
Yes, yes.
fully faithful to the physician, and one is doctor centric, because usually doctors which are not very expert and they prescribe so much of medicine. I'm not talking about only Ayurveda doctors. In all pathies we see that doctors prescribe so much of medicine, so much of laboratory investigations, so patients get more stress out of that, because there is a statistics on studies of the hospitals. It states that uh, the percentage of patients getting treated is very less, and the percentage of patients getting more disease from the hospital is very high. So it's a hand in hand approach. The doctor should also examine the patient comfortably and convince him or her very smoothly, and patient should also take sincere steps, which whatever told by the doctor. And what the beauty of Ayurveda is, like I said, that Ayurveda has all options available for every type of patients. Like if we talk about the preparations like churna and the powder syrups and the avle kalpanas, these are all made on the basis of that the bala of the patient, the strength of the patients. Like in the geriatric
Exactly.
scenario, we see that chavan prasha. So chavan prasha could be made in the syrup form, could be made in the tablet form, but at that time, for authentic result, it was made in avle form for the geriatric rishi chavan. So we have all kinds of options available. You take faithfully, and even the pharma companies are getting very modern these days. We have all options available. Like madam said, that kashayas are also available in tablet forms, so you don't be worry about the size of the tablet. You just take it, and it will give you very fast relief. Like you say that Ayurveda is slow, Ayurveda is not slow. If you follow the steps sincerely, you will get very fast relief. So uh, if you talk about present, ma'am, like you have gone through various research activities, studies, and you treated many patients. So what you message want to give to me as your junior and to the listeners?
Uh, this take home message you can say, we adopt Ayurveda in terms of Dinacharya and the Rutucharya, because the Swasthasya Swasthya Rakshana is the main motto of Ayurveda, and adopt a healthy lifestyle to make your old age is as a gold age.
Yes, ma'am. So definitely people will approach, and those
One
people
more thing.
seeking. Yes, madam.
Well, this you told no, Dr. Vikas. If at all, see, the people come to us and Madam, I want, or Sir, I want to do Panchakarma. They don't know actually what Panchakarma is. We, after certain age, after 70, we cannot perform the actual Panchakarma, that is the emesis therapy and the Panchakarma purgation therapy over the age above the age of 70 years. But considering the strength and the need of the patient and his or her comorbidities, like if at all he suffers from the diabetes or the hypertension or the heart disease, considering that we can prescribe the panchakarma. Of course, consider that yeah, Basti therapy is the safest procedure to have in the um, one can have in the old age also. Even the Nasya therapy, there is no age limit for the na Nasyam Una Saptabde, na Tita Shiti Vaksare, na Shuddhir Una Dashame, na Cha Atikranta Saptatau, Ajanma Maranam Sastha Pratimashyastu Basti Vastu. From the birth till the death, one can practice the Basti therapy. That is the more of the Anuvasana Basti or the Sneha Basti. So, and even Nasya you can perform. And the considering the age of the person and the disease, and you can prescribe the Panchakarma therapies also. And that is one more therapy is that is the Murdi Taila. We are having the set of the therapies which we can perform in the Urdhva Pradesha, that is over the head, like head massage and Shiro Basti, Shiro Dhara. That is a famous procedure, and most of the people know Shiro Dhara. They are pouring the oil over the head, and Shiro Pichu and Padabhyanga, massage therapy that we can prescribe at any age. So it is. that need to be convinced to the patient by the doctor.
So
And
those
once again, I
people
thank you.
are now. It's my pleasure, ma'am, to host you. You are my always well wisher. Those people who are seeking Panchkarma treatment in the Vadodara, Gujarat region, they can definitely go to Parul Institute of Ayurveda and Research. There you can get consultations from Dr. Divya Madam, Panchkarma in charge. And those people who are from Hisar, Haryana region, you can have consultations from me at my hospital, Ananda Hospital. We will provide you best possible Panchkarma for you and for your wellness. So till then, I thank you, madam, for giving us valuable time and so much of knowledge.
Thank you so much.